Sounds good. All right.
All righty. And in 3, 2.
Hello and welcome back to our segment here at 71 Magazine. We're happy to have with us from DC CAP, Suzanne Craig, Program Manager, and Dan Eaton, Case Manager. So guys, we are so happy to have you. And you're
Thank you.
a Senior Case Manager.
That's right.
So I do not want to slight your title at all.
Yes,
Trust
yes.
me.
Well, I'll take that as a youth compliment, not as a slight. So
That's right. That's right. But can you tell us, Suzanne, as we get started, what does DC CAP stand for?
It stands for Davis County Community Access Project, and we're proud to be in the Green River District Health Department as an outstanding program that helps a lot of people with access to care needs and prescription assistance, help with their Medicaid, anything you could think of related to access to care concerns that we are very passionate about in the community and within the health department.
And there are so many people think once we had expanded health care that those things went away, and we know very well, both of us being in the healthcare community, or all three of us being in the healthcare community, that is not the case at all.
That's exactly right. When we started a little more than 12 years ago, that Affordable Care Act did not exist, and as it became available, we became connectors and assisters to help people sign up for that. But we learned very quickly that there's still a lot of gaps in access to care. One being people being able to afford their medications. Medications have continued to go up especially the last 5 years. For example, insulin has gone up 300% in the last 3 years. And so we see great increases, which means that people often get where insurance companies will no longer cover that medicine, or they'll get in coverage gaps with Medicare. So they find themselves doing everything right, working the way they should, but finding themselves with a chronic condition.
Well, and Dan, this is where I'm gonna shoot it over to you. Even though we know insulin falls into the prescription assistance program, tell me about that program, the prescription assistance, and then we'll talk about some of the experiences you've had with some of the medications.
Sure. So there are over 5,000 drugs that have programs directly through their pharmaceutical companies that will offer assistance for folks who can't afford them. Maybe their insurance doesn't provide coverage. Maybe they're at a place where they don't have prescription coverage. There could be a whole lot of different reasons why they can't afford that medicine. Maybe it just doesn't cover enough of it for their financial situation. But there are over 5,000 programs and we have a database that we can look at their situation and their prescription and see if they may qualify for some financial assistance, often a donated supply of medicines, including insulins.
You know, one of the things I think we take for granted in having health insurance is prescription coverage. You automatically, I say automatically, maybe not everyone, but I have been under the assumption that, well, I have insurance, so that prescription will be covered, but I've never had a chronic disease. And that is where it's a double-edged sword. They may have health insurance, but
it may not cover
their need,
their exact need, their prescription need. And so the pharmaceutical companies do have these programs out there. Unfortunately, it can be very confusing. There are very specific guidelines for the programs, and it's a little overwhelming with so much out there. And so that's where we can come in and tailor a program specifically for a patient's needs. For example, someone who has worked all their lives and had good insurance at work, now they're on Medicare, they may not realize they have to then go out and purchase prescription coverage through Medicare, a Part D plan. Or if they do purchase a Part D plan, they may not realize that at a certain point of the year right now, that prescription coverage will essentially cease for a period of time as they're spending. There are programs out there to help with that. When someone goes to the pharmacy and suddenly what they've been paying $40 for is $400, then that may be the first time they know they have that need. And I'd urge them to call us then. That's when we can come along and help them with those needs.
Well, and that's my next question. Sometimes they may not know, Suzanne, until they get to the pharmacy and they're told that. How do folks find out about you all? Is it a referral? Are pharmacies aware, physicians, or how do they know to contact you all?
So we view ourselves as a friend to the community at large with their access to care needs, but we also view ourselves as a friend to the medical community. But we can't do it without them, that we work in combination with their efforts with prescribing and being willing to sign our applications. And so what happens is that many times we get referred from the doctor's offices, from many community partners. We go to many health coalition meetings and have quite a few partners there, and just throughout the community. And so they usually will call the health department number, or they will show up in person at 1600 Breckenridge Street. And so I would just like to tell you that this is such a problem that over the last 12 years that we've been able to coordinate more than $33 million worth of prescriptions.
Oh, wow.
So we're not talking about just little seeds of help, but we're really passionate about meeting the needs, and there's so much more out there. Every day we get introduced to someone with a new chronic condition, whether it be cancer, MS, diabetes, even hypertension and other more common. And so it's definitely, we try everything we can, including talking to you today, just to get the word out there about that we want to help. So this is not a government, like this is not, some people are scared to ask for help because they're like, well, I don't want to get welfare, or I don't want to. These are pharmaceutical programs where the pharmaceutical companies say, I want to help this person, this kind of person. And so we just work through a system that already exists. They know there's gaps. Even the pharmaceutical companies know that there are gaps. And so we're just very passionate and become really experts in that system to meet that need.
Well, and one of the things, Dan, I'm going to ask you about, and Suzanne, this is for you as well, but in the medical community, I've been at some of these health coalition meetings in my full-time position, and you hear the word donut hole. And to the average person, that means something you get at a local bakery to munch on in the morning or any time of day that you choose. But in the medical community, there's a hole somewhere, and as it relates to Medicare. Can you tell us what that is and how that impacts?
Sure. Basically, when prescription coverage very first started for Medicare, what people will hear called their Part D plan that covers their prescriptions, one of the cost-saving features that was built into the program at the beginning was a period of time within the plan where there is what is called a coverage gap. So there is a period of time where the prescriptions are paid for, you pay your copay, and you go along your business, and then suddenly you have to pay nearly full price, 90%. Once you have spent another certain amount, you come out of that gap on the other side. So there's coverage before the gap and after the gap, therefore they call it the donut hole. Now, when that was first put in, there was a phasing out put into that legislation. In 2017, a person doesn't enter the donut hole until they have spent a total of $3,700, their insurance company plus their copays, totals $3,700, and then they enter that gap for a $2,200 period. If nothing changes, so as long as nothing changes with the legislation, in 2020 the donut hole will go away. But for the time being, we have it. And the problem that has happened since the legislation was first envisioned and today is that some of the medicines have gone up 300, 400%. So what was originally someone might enter the donut hole in November or December, now I have patients coming to me in March or April and have entered that donut hole. Now, one of the things I want to emphasize about that donut hole is that some folks will say, well, I make probably too much money to qualify for help.
That's a good point.
Because I with my retirement and my wife's Social Security, well, maybe we're getting $35,000 between the two of us. So I can already guess that's probably going to be too much for me to have help. If you're in the donut hole, there are a lot of very generous guidelines to help, because even though you're making a good living, no one can afford $2,000, $3,000 a month toward medication. So it's free to apply and check out, so you might as well do it. There's a good chance that something can help you.
One, I think people don't realize, and again, this is only from my own experiences in healthcare, is there are underinsured people. And again, the assumption is made, if they're familiar with other programs, federal or state programs, that I make too much money. But when it comes to insurance, you can be underinsured and there still be help available to you. And we've just got to, and I know sometimes too, you all probably experience folks who are trying to decide whether to keep their lights turned on.
Or buy their groceries, or buy their
Exactly.
medicine.
Yeah.
We hear that a lot, unfortunately. And if anyone's in that condition, it doesn't hurt to check and try, because a lot of times we can help. I will say that we were able to assist someone who by anyone's standards had a really good living, and had always had excellent health coverage, still had excellent health coverage. However, he was diagnosed with MS, and he was quickly losing the ability to walk. There was a new medicine that was available. His total cost with the dosage and everything that he needed was going to be nearly $100,000 a year. Now, assuming, he assumed for the longest time that that just wasn't an option.
Yeah.
And he was walking with a walker for a while. And we were able to get that medication donated to him. And he's since moved to Florida and enjoying himself again. So, there are programs out there for your specific situation. I would say one of the most exciting things that we do is we take the person when they come in as they sit in their situation, and we try to find ways to help them.
And that's so fantastic. I think it's when people don't know, they should call, correct?
Absolutely.
Absolutely. And, and I can't say enough about the case managers at Green River District and the CAP project is that how much they care about meeting the patient's needs. And so they won't be degraded in any way. They'll be very much respected and talked to and worked with meaningfully to try to, so that when they leave, they always try to leave them better than the way they found them. And so I'm very appreciative of the whole program's effort to how we treat patients.
And another thing that I've noticed, especially with your case management staff, is the ability to navigate them to other things that would benefit them in their health care.
Absolutely, because problems often don't happen in a vacuum. So, so for instance, if we help someone with insulin, well, they need electricity for a refrigerator to put that in. So if their electricity's been turned off, and people find themselves in very urgent conditions where they're making hard choices and no fault of their own. Like, we've helped a lot of people who've been laid off from jobs and so forth. And so they may need anything from heating assistance to other kinds of help, housing needs, shelter needs, a full range, might even need to get on WIC or food stamps. And so we really try to assess, do we know other places that can help them, and try to coordinate those efforts so we help the person's entire, the whole system to try to help the person and not just one service.
Well, and also too, you think about the number of things that when a person has a chronic disease, their likelihood of having other illnesses increases because of weak immunity and so forth. So when they're good mentally and they're better physically, you're helping the total person.
And it's so exciting when they come, and sometimes their A1C was off the charts, or people sometimes lose limbs and eyesight and all kinds of things because of having high blood sugars. And when you could help them get it under control, they often, it's a regular occurrence for people to drop in and say, just want to let you know my A1C came back today, looks great. And so when you know that all of the very detailed work that you're doing and coordination that you're doing, and it really pays off in a very tangible quality of life for that person, there's nothing better. And we're very fortunate at Green River District that they allow us to have that passion and foresight to meet that community access need.
Well, one of the things, Dan, that Suzanne shared when she sent me the information for today's show was actually a thank you letter from a client. And I think that speaks volumes for what you all do. Suzanne mentioned it just then. Being a senior case manager, I know we don't go into the jobs we go into we would probably have gone into more lucrative jobs if we were looking for a paycheck, correct? But the reward that must bring, this lady was referencing her inhalers.
Right, right. And it is a regular occurrence that you know, it's a fairly desperate feeling to know that I need this to breathe. I need my insulin. You know, the doctor has warned me I have to have this or I'll go to the emergency room. And to not have a solution and then to have someone give you a 3 or 4 month supply in your hand, we get a lot of thank yous, and it is very rewarding. But these patients become close to us pretty quickly, you know, and we're glad to help, and you know, and very often find ourselves going above and beyond, but not because we're some great folks, but because the need's there and we want to meet it.
Yes, absolutely. You know, Suzanne, as we wrap it up here, because I was very touched by that letter, because I know that if you've got a health condition and you're unable to work, you're unable to provide, you're unable to have health insurance anyway, even if it's there for your provider. So you're giving people quality of life, quantity of life, and there may be folks out there that need more information about your program and they'd like to experience what this lady was experiencing here. How do they get that information?
So what they could do is they can come to the health department and they can call the main health department line, or they could call our program directly at 270-852-2904. And they could call us, and no question is silly or ridiculous, and we'll really meet with them and try to get to know their circumstance and see what we could do to help.
Well, I think this is a fantastic program. I've learned even more about it today and through the research that was done from the information that was sent to me. And I hope that if folks in the community know someone, that they pass the word along, pass the phone number along. So,
Absolutely.
So thank you guys so much for being with me
Thank you,
today.
Jamie.
Thank you, Jamie.
And again, we'd like to thank you for watching 71 Magazine. We hope you're going to stay tuned for some more great community programming here on Channel 71.